because pharma industry provides you that platform, and you will be part of them as a researcher, as a medico marketing professional, as a medical affairs professional, as a so you may serve as a regulatory consultant, as a clinical research consultant, or as a pharmacovigilance consultant, or in the clinical pharmacy and clinical pharmacology department in corporate hospitals, because many
Mind blowing, actually. So many opportunities are there.
and find out which is the richest industry on this world. Okay, so if you see, many people think that it is the IT industry, but that is not the truth. Okay, it's not true. It is the pharma industry. Okay, so pharma industry is around 1.7 trillion, 7.
Hello, all. This is Dr. Dheeraj Masapu, and today we are going to discuss about the scope of pharmacology. And we have Dr. Shivamurthy with us, and sir is a professor and HOD of Department of Pharmacology in Dayanand Sagar Hospital, Bangalore South, Karnataka. And not only that, the sir is the founder president of a Medical Pharmacology Society, and he has 23 years experience in the field. And he has done several publications, and he has written several chapters in the textbooks, and so many books written, organized so many events. So he, in simple words, if I have to tell, he is authority in this area to talk about this subject. So welcome to the channel, sir.
Thank you so much, Dr. Dheeraj. I really appreciate you in your busy schedule. You have taken up such a noble, activity to guide the youngsters, because very less people, have that intention. I believe that your intention is to connect to the youngsters and guide them in the very early stage of their career. I think like one in Kannada we say ಗಿಡವಾಗಿ ಬಗ್ಗದ್ದು ಮರವಾಗಿ ಬಗ್ಗೀತೆ. So it means that like when it is a small plant only, you have to turn and twist or give the directions in which direction it should grow. Once it becomes a big tree, we are not able to bend. So that's
Yeah.
something which is very important. I believe that if I catch you properly, I think this is your intention, so that like youngsters get the most from your shows.
Yes, sir. Because when I was in their shoes, nobody was there to guide. So I thought somebody should do that.
Yeah,
Uh,
yeah, yeah. I
in the
agree with you,
social,
because we are
yeah,
all like that. We all grew like this only, like without any guide, without any I would say like backbone or godfather. So we all took our own path. We took long time just because we have to do experimentations to find the right path. So that's why we took so long. So I'm sure our youngsters are more smart enough to attend shows like this and then take the right decision at the right time.
so thank you, sir. Sir, my first question to you is, so who should take MD pharmacology in NEET PG counseling?
Okay, so it is like if you ask me, like otherwise you can ask me, did you aim to become a pharmacologist?
Hmm.
So answer was, like definitely I never thought I'll become a pharmacologist. And every MBBS student or a professional, they would like to a doctor, allopathic doctor. They would like to become, like very close to their patients, their treatment of patients, and serve the people. So they think that like that is the means that's the main reason why they took the MBBS. But as all of us know that like that is not the only way. Okay, that is not the only way. You can like if you become a doctor, you may serve only 20 or 30 or 50 patients a day. But if you become a teacher, you'll create, you'll create the ecosystem where your students will be treating thousands of patients. So you are the person who created that ecosystem through your intentions to do good things to this profession and to the society. So if we limit ourselves, it's all about how we think. If we limit ourselves to a particular way of thinking, then our objectives will become limited. But when you grow from that a very tubular vision, you can have a broader vision also. So in that way you can. So to come back to your question, what you mentioned, that like who should take this pharmacology. The answer is not so easy. Answer is not so easy. You can, I think you can keep your video on. So it's the answer is not so easy. But if someone is very much interested in various jobs, like if you become a doctor, you will be treating patients only. But if you become pharmacologist, there are so many areas that are open for you to occupy positions. Like it can be right from your pharmaceutical industry jobs. Okay, so if you become a pharmacologist, then you are the most preferred person to join medical affairs department any pharmacology in any pharma company. So generally, like in India now, it is open to the world, and India is called as the pharmacy of the world. So in that way, all the major companies are there in India. And if you know, like if you do little, I suggest everyone to do a little bit of Google search and find out which is the richest industry on this world. Okay, so if you see, many people think that it is the IT industry, but that is not the truth. Okay, it's not true. It is the pharma industry. Okay, so pharma industry is around 1.7 trillion, 75 trillion. Okay,
Wow.
1.57 trillion industry, but IT industry is 1.72. Okay, so pharma industry is ahead of every industry on this earth. Okay, especially. And the so pharma industry means it is not just like doing the medical marketing. It's not like that. So you will work like a scientist. Like as a scientist, you will have liaisoning opportunities with the big pharma professionals. There can be scientists, Nobel laureates, or like you will get opportunity to meet them in different countries also, because pharma industry provides you that platform, and you will be part of them as a researcher, as a medical marketing professional, as a medical affairs professional, as a right from writing the protocol to launching the molecule to the industry into the market. So like that, you have varieties of positions, especially in pharma industry. So in that way, so you may serve as a regulatory consultant, as a clinical research consultant, or as a pharmacovigilance consultant, or as a medical affairs consultant, or medical writing consultant, like this. Okay, even after the launch, maybe generic drug development is another big area where you can guide the next generation companies. Okay, first generation companies are the originators, but next generation companies are called as generic companies. Okay, so again, like that is a lifelong, like so generally patency will last for 20 years, but after that, the molecule is open for anyone to manufacture. In that case, like it's again big opportunity for every company and for every country also. And in that way, like a lot of business can happen there also. So you will be part of that business. That's the point I would like to make. Okay, so this is about the pharma industry. Then, if you come back to academics, you can work like, all of you know already. That's the one of the most well-known job. Everyone knows that you will start with the SR, like say a senior resident in the Department of Pharmacology, and then you will start become assistant, associate, and professor, professor head. And if you see that, like if you count, how many MD pharmacologists are deans, principals, or university vice chancellors, you will get many. Because, like they are the people who are available to, serve the institution at various levels right from the beginning. Like they will start serving as the maybe NIRF coordinator, NIRF ranking coordinators, or some criteria, owners. Or then they will have ethics committee, pharmacovigilance committee, pharmacotherapeutics committee. Then you will have ethics committee, and many, and also you will be in the MEU, medical education unit. Like this, you will get involved in all the activities that are required for running a medical college. And generally, pharmacology department is the one, preferred for taking the friends, my friends, into those committees, and they will get involved in running the operations of the medical college. Obviously, over a period of time, they are available and they are well experienced, and they will be ready to take the positions as vice principal, principal, dean, and director. So in that way, they are the most preferred in the academic side also. Then, it's not only one medical college. You can work in medical colleges. There are 780 medical colleges already available now, and it will keep on increasing. Maybe it will be there are around 1,000 in another 5 6 years. So it can become 1,000 medical colleges and requiring so many professors and associate professors. Similarly, if you consider dental colleges also require pharmacologists, then nursing colleges, then you have a physiotherapy college. They may not hire a full timer, but if you are there in a medical college, you will be given opportunity to teach them also and learn. And you know that medical pharmacology society is very strong nowadays. Okay, and we are giving opportunities for people to learn and participate in webinars, conferences, participate in prizes, like as a competitor in various categories, including the most promising young and senior pharmacologists, and also lifetime achievement awards. And we are, like creating opportunities to present papers, scientific deliberations, and then we are working towards developing the journal and launching them. So like this, like very much involved in varieties of activities to attract the professionals, may give them opportunities so that they are not they are not depressed, they are energized to serve their profession. So in that way, we can be one of the most important contributor to the healthcare. So this is the one part of our academics. If we go back to the other parts of the academics, even in academic institutions, you can do a lot of research. Okay, you will be getting opportunities as examiners. You will be getting as PG guide opportunities as PG guides. You will be working. You can establish a clinical research center in your hospital, in your medical college. So, being pharmacologists, they are the most preferred people to head the clinical research unit in the hospitals also, or in the medical colleges. And pharmacovigilance activities are already going on, and ethics, like ethics committee will be there, so you will be member of those ethics committees, or as a secretary or as a member you will be serving. And then you can you can run the clinical trial center, in your, so that you can attract the multinational trials and the Indian trials also. So in these clinical trials, you have so many things, right from your herbal trials, or allopathic trials, or food nutraceutical trials like this. You can do many. So you can establish your own data management centers. Some people are doing it also, and you can be a site management. You can be a site for the multinational trials, as I mentioned to you. And similarly, you will be working with all the clinicians, because you don't need to work only in one area. So you suppose a diabetes trials, then you will work with medicine people or diabetologists. If it is a neuroscience, then neuroscience neurologist you will work, or neurosurgeon surgery means trial, it will be, you will be working with neurosurgeon, or like any other, like ENT or any other department, like that. You will be working with varieties of clinicians, so you can do that also. And then if you as I mentioned to you, maybe I will take
Yeah.
up next
Yes, sir.
question.
Yes, sir. Sir, actually, mind blowing. Actually, so many opportunities are there.
Yeah, definitely. Pharmacology. I see. It is. I always tell my colleagues, the pharmacology is a subject. If you want to work only as a teacher, okay, you can take 2 3 classes, and then you can enjoy your peaceful life. You don't
Hmm.
need to you don't need to scratch your head. Okay, you can prepare your PPTs. If you are busy, you can also do clinical practice. Nobody will stop you from this, because you are already an MBBS graduate. So you
Yeah.
can own a clinic, you can own a hospital. As a general physician, you can very well do that. And then you can take the classes, you can manage, you can be happy doing your clinical practice, and you can also do your teaching job. So that is one part. Then if you are interested in little bit more research, then you can establish the research activities and all those things in your hospital and in your department. You can do basic research. Okay, you can also do animal studies. Okay, preclinical studies, toxicity studies, or area specific. There are so many models are there. Actually, we do like if like a rat tail flick model, or pole climbing operators, or rotor rod. These are our maze operators. Like this, varieties of models are there for screening the molecules for varieties of diseases. Okay, so or the cognizant properties, or motor coordination properties, like this, varieties, like even anti-diabetic property, or hepatoprotective property, like this. Varieties of models are there. We are all taught about that. Okay, so we can do those research activities. We can support the pharma industry as a preclinical scientist or as a clinical scientist. So those things are also available. In addition, we can nowadays, like lot of preclinical, I would say, newer models have come in, like cell based models are available, or genetic genopharma, pharmacogenomics we call it as. So pharmacogenetic studies also we can do. So like this, we can do. And there is lot of opportunities for you to think beyond, because now the software is also available. So you can think of developing softwares to organ on a chip, or like this. Okay, so softwares can be used as the toxicity testing models also. So you can use softwares for developing the molecules, and screening the molecules at the early stage. So like this, like pharmacology is a very interesting subject. Okay, as you study pharmacology means it is the study of drugs. So study of drugs for the purpose of treating the patient, or normalizing the physiology, or maintaining the physiology, or diagnosing a disease. So like this, that is the basic definition of. So you can do anything on this earth to develop a molecule, and you can enjoy. Most importantly, your focus is important. Generally, what the since the our MBBS students, they are moved in such a way that okay, you have a patient, you have to treat. You have a patient, you have to treat. But nobody teaches them that this is also a research based job, and there is a wider area open for you. Nobody teaches because it is not the objective. If you see Indian medical graduate, they need to become team player, they need to become a lifelong learner. All these things are there. Okay, so there is not much of emphasis on the research activities or the developing the person in a different angle. So that is not there. Slowly, our people are picking up, and if you ask me, if you leave any people, like actually there is a problem with the curriculum because there is a posting for forensic medicine and PNDSM and the various departments are there, but in pharmacology they don't post. Okay,
Correct.
so especially students what they experience, so we always bombard them with classification and mechanism of action, and then adverse drug reactions and uses and all, so which our students find it very difficult to memorize, and finally they think that okay, somehow if I pass, let me move out of this pharmacology. It is such a means difficult subject. That is the thing which enters into their mind. But if you post a person in our department for 1 month or 2 months, I can bet you that many of the girls and some of the boys would like to do pharmacology. Okay,
Mm.
if they see how we live in our department, how we coordinate and what we do, how what kind of works we do, if they see us, and I'm sure they will not leave us. Okay, they would like to become our family members, pharmacology family members.
This video will help, sir. Actually, our video.
Yeah.
I'm assuming a lot of NEET PG counseling students would see this video.
Yeah.
Actually, if you give me a time machine now, I'm feeling like taking MD pharmacology now after listening to your.
No, the thing is that, see, I am a unique person where I got varieties of opportunities to work. Okay, that's why I can speak more, more about pharmacology. I can tell you how pharmacology entered into my life. So
Mm.
it enters. Even I was like you. Okay,
Yeah.
I entered by accidentally. Okay,
Okay.
me and my friend we went to Siddhartha Medical College immediately after MBBS to join as a tutor. Okay. And my objective was to read for the entrance, and his objective was also to read. Then we both confronted. Okay. I need pharmacology, I need pharmacology. My objective of pharmacology was that, it is one of the difficult subject, and it is covered in medicine. It covers majority of the questions from every department. Okay, so if I study pharmacology, at least I will be able to get better score in the entrance. That was my objective. So that one way I will be teaching and I will be learning, and it will be since pharmacology will be very nearer to me. So maybe I will grasp better. That was my objective. I never wanted to become a pharmacologist. Then after started working in the department of pharmacology as a tutor, 1 year I worked there. Then I got to have a sense. Lot of pharmacologists, they used to come and work those days. Consultants, they used to be like consultants. They used to come, take 2 days. 2 days come, they take classes and they go off because so many pharmacologists were not there. So they on call means it's almost like anesthesiologist. Okay, 2 days in
Okay.
a week they used
Got
to
it.
come, they used to take the class and then go. That was the trend. Then I saw, see, they did not had anything. Only their knowledge is there, and they just come, they vomit their knowledge and then go back.
Mm.
And you don't require a OT, you don't require anesthesiologist, you don't require any big setup. And I coming from a very poor family, and I don't have any investment to do. Means I don't have money to invest also. So in that case, like okay, I kept on observing, and then I got involved in teaching the students. Okay, I started teaching practical pharmacology, doing all the experiments, frog experiments, rabbit experiments, like this and all. I used to do. I used to teach the students. Then I got the hang of the pharmacology, what it is, how it is. I started reading also. Then, for my good luck or bad luck, I don't know. Maybe it is a good luck to pharmacology. I mean, pharmacology
Yeah.
was, like somehow. So then I did not get a very good rank in my second attempt. but there was a pressure from my home that you need to do something. So I decided that okay, anyway, I'm already there in the pharmacology department. I know it in and out of it, and I saw a lot of opportunities are there in an industry. And those days in 1998 and 2001, okay, at that time only they signed the TRIPS agreement, and because of that TRIPS agreement, a lot of international companies started coming into India. Okay, so because of we started respecting the from 2000 onwards, we started respecting the patency. Okay, throughout the world, similar to how the other countries, we also started respecting patency. Because of that, decision. So a lot of companies started funding in India and started their branches here also. And there was a lot of news every time, every week. I used to see the news that clinical research and drug development will boom in India. So that was the time. Then I took pharmacology, and then I aimed to become an industry pharmacologist. Okay, so I started working very hard, and I put my day in day out, and I used to do a little bit practice also during my PG days also, because just to like I keep on reading pharmacology, it will be it will go overhead. Let me have a relaxing time, evening 7 to 8, say, 6 to around 5 to 8 or 9 o'clock. I used to see some patients, maybe 10, 20, then come back and again read. So like that I used to do. So it was a very interesting, days. So interesting days those were. So finally, I finished my MBBA, MD, pharmacology with flying colors. I achieved the first rank in RGHS.
Oh, wow.
Uh, yeah, so that was the one good thing for me, and I put so much of efforts. I put what I did during that 3 years. I visited wherever there is a conference or workshop. Anyone announces it. Maybe it can be St. John's, Manipal Academy, or any APPPI or IPS conference. Anything that comes to my mind, immediately I will be the first one to register. Okay,
Got it.
so immediately register and then go. Okay, and in that way I learned a lot, not only from our department, from all the different departments across Karnataka and also Tamil Nadu and Kerala. So like this, that helped me to have a broader view of pharmacology. And then finally I passed. I also presented 4 papers during my pg days. Those days it was not mandatory, not even one was mandatory. So I presented 4 papers, and I also my paper got accepted in an international conference of neural or
Okay.
neuroscience. So then I went down to Maldives and then presented there also, and then came and I achieved the first rank. So with all these combinations, so St. John's opened the door for me.
Hmm.
So even though I studied in Ballari Medical College, one of the rural medical college, rural Karnataka Medical College, but I got position in St. John's. So in that way, that really helped me to kickstart my journey as
Super.
a professional pharmacologist. And then I worked in the clinical pharmacology department for 2 years, and there I got opportunity to work in the international registries on epilepsy and pregnancy, and then I worked on some phase 1, phase 2 trials related to some herbal medicine for allergic rhinitis indication, and then I also worked in therapeutic drug monitoring, developing a manual for it, and also I worked on some more one manuscript development on glutamic acid. So like this, some of this I did, and then finally my department, again pharmacology department at St. John's, they supported me, helped me to get into industry, and there I had a flying career. So I my salaries went up and started very well, and then I became head clinical operations, and then well, I head of like I started with clinical investigator, co-investigator, clinical investigator, chief clinical investigator, head clinical operations, associate director, then director, and then head of regulatory. Like this, my position went on, and I worked in multinational companies, also Indian MNCs, also, and some of the CROs, contract research organizations. So I gained a lot of experience from all of them, and then I moved across to I started feeling there is some kind of stagnation in my life, and maybe started aging also. I thought, okay, I have gained enough of experience in right from the pharmacovigilance or BAB studies or generic drug development and the regulatory affairs of newer molecules, and then data management, medical writing. So like this varieties of opportunities, data management to medical writing, statistical analysis, like this, I headed different companies in a different way. So I got the hang of some important services offered by various companies. And then I started thinking that, okay, I should move back to my academics. So after St. John's, I worked for a short while in Mahatma Gandhi Medical College, Pondicherry. And then I started with Wayanad Institute of Medical Science. And then now I am with Dayanand Sagar. It is called as the CD Cymer, Dr. Chandrama Dayanand Sagar Institute of Medical Education and Research under Dayanand Sagar University. So in that way, I'm using my all these experiences to give my best to my institution. After coming here, I we developed a patentable activity. So I collaborated with IT company, IT department. That is, we have engineering college next building. So we, through the engineering college and medical college, we collaborated, and then we developed the algorithm for predicting the hypokalemia as an adverse drug reaction when we give different drugs. So like
Oh,
that. So we developed the algorithm and then we applied for patency. And similarly, many other activities like artificial like AR, VR, augmented reality and virtual reality projects also we started working in. So like this, like move from like see what I'm saying is integrating IT infrastructure into pharmacology is also very interesting, and like going with the flow basically. So we should be innovative, and in meanwhile, what happened in around 2016, I felt the need for bringing all the MD pharmacologists together. Okay, because like if you have seen, I don't in Ballari Medical College. Again, I did my UG there also. We did not had many pharmacologists. Okay, only one HOD and one MBBS person who is working as a tutor, and he was teaching the pharmacology. And we did not had any like very vibrant pharmacology department. They were just teaching and reading slides, or like not much of it was more of a monodialogue, but not the like it's a kind of discussion or anything. That kind of pharmacology we have been taught, but that was there in my mind. Okay, since I entered into pharmacology department during my MD days also, we did not had any full staff. So they were all working in silos, I would say. And most of the pharmacology department throughout the country, they were all like that only. Okay, maybe manned by two, three people, and one head and two assistant or associate, and finally somehow like managing the day-to-day affairs that was going on. And not much of conferences were happening, not much of opportunities were there, and not much of collaborations that used to happen. So but I thought that, okay, I think there is an opportunity for us to bring everyone together. So we constructed the society called as Medical Pharmacology Society. Okay, so that was the social angle which got engraved into my concepts. So I started this Medical Pharmacology Society with another 10 people. So total 11 people we started, and then we started integrating all the departments across the country through this. So currently, through our society, we have connected to more than 2,000 medical pharmacologists, medical pharmacologists throughout country as MD pharmacologists, and they are not our members. Basically, they are the WhatsApp group members. Okay. But we have crossed already 200 registered members in our society, and we are improving every day in day out. So more number of people are willing to join. They are finding usefulness through whatever the activities we are doing, and we are conducting regular pharmacology conferences like MPS Con. MPS Con 2024 we conducted, 2023, 2025 also conducted, and we will be conducting next conference in our city. Like see Bangalore, Bangalore, at CD Cyber we will be conducting. So like this we are giving, and we started awarding, lifetime achievement award. We started giving. We started giving most most promising senior pharmacologist, most promising young pharmacologist, and then we started awarding the best paper awards for UGs, PGs, staff, both in oral and poster categories. Like this, lot of enthusiasm is infused. And we also did one activity, that is GCP conference we did. It is called as MPS NCTS, National Clinical Trial Summit. Okay, 2023 we did. It was a most one of the most successful event where 400 plus people joined to learn GCP, and it was conducted in a very nice way. And we also released a book during that time. Okay, as it is called as Clinical Trials Management book. Okay, it was an e-book, and later we made the hard copy also available, and it is already more than 500 copies are sold already. So like this. Then in the last year in 2024, what we did, we introduced another concept that, like, why don't we invite the chapters from various pharmacologists and start building the postgraduate, knowledge material. Okay, now, so knowledge material required for the postgraduates. So we started releasing Crucial Pharmacology Trends, Volume 1, Volume 2. Last year we released. Now we are working on another 120 chapters. Okay, 120 chapters. So most probably we will release another 2, 3 volumes for our postgraduates. So Crucial Pharmacology 1 and 2 is already there in the market, and I almost completed the editing of Crucial Pharmacology Volume 3, and Volume 4 I will start, and Volume 5 also most probably by end of this year we will be releasing them. Okay, so and I believe that like the enthusiasm of our MD pharmacologists is so much. We will we will continue to do this, because we have started going by papers. Paper 1, paper 2, paper 3, paper 4. Because as you know that MD pharmacologists have to write 4 papers. So first paper is general pharmacology and related pharmacology related, and then basic pharmacology. Then paper 1, paper 2 will be volume 1, paper 2, paper 3 will be volume 2, and then 4 will be biostatistics, research methodology, and other things. So like this it will be there. So we will continue to develop the reading material, knowledge material, and most probably it may enter into Guinness Book also, I would say. Because like if you continue developing these things, the number of chapters that will be included will be one of the
Highest.
milestones. So something like this, we are doing, and it is all done with the intention to support our MD pharmacologists and the medical pharmacologists, so that not only MD pharmacologists, these books can be taken by any postgraduate. It can be MSc pharmacologist, or if a neurologist want to read something related to pharmacology, they can also take. So like this, we are working, and I believe that these hard work what we are putting in, and it will be remembered forever in the
Got
history
it.
of pharmacology. Yeah,
It will be a legacy. I understand.
yeah, yeah, yeah,
Superb, sir. So it's a mind-blowing discussion about
yeah,
pharmacology.
yeah,
So now I would like to ask you another question. So if somebody wants to only stick on to the industry side,
yeah,
so then so basically if they start different posts are there, like as you told, I
yeah.
actually forgot some of the names also. So but
Okay.
there are so many posts available. So if they stick on to industry side and continue there, uh, they see a very good growth in finances and all that also. Correct, no,
Yeah,
sir?
money.
And
Yes, yes.
then,
I think money is, what I'm saying is, generally I suggest our juniors not to go behind money. You go behind knowledge, money will come follow you. So that's the one of the underlined sentence I would like to say, that you just do your job, concentrate on your job, and like results will automatically will come in. And most importantly, see, there are other people who are trying to come into pharmacology, like pharma d pharma d is,
Hmm.
there is another
Yeah.
profession, like a pharmacist. Basically, it's a kind of pharmacist, like pharmacy, B pharma, M pharma, clinical pharmacy, both subjects, both the degrees put together, they have made it as a pharma D, and their objective is to become a clinical pharmacist. So in that way, I don't think like in any way, because MBBS is the basic, like I would say that that gives you a lot of bandwidth. And if you, on the top of it, if you do MD pharmacology, and there is no combination can match that MD pharmacology, because
Got it.
in nowhere in the world we have this kind of this kind of opportunities. Especially only it is mainly in India only. In other countries, majorly they hire PhDs, but MBBS and MD, it becomes a very unique combination. And most of the MNCs I have seen, many of my friends, they get into MNCs and they will be keep on roaming throughout the world. Okay, so they will be heading the clinical research unit, they will be heading the pharmacovigilance unit, they will be heading the medical affairs unit. And generally, nobody else can match this, because they don't have such kind of, because basic MBBS, studying every subject in medicine, and then on the top of it, specializing in pharmacology, it's a very unique and it's very interesting. And the MD pharmacologist will become a very big asset in any pharma company.
Superb, sir. So basically, what is happening now in the medical field is everybody is behind surgery, everybody is behind general medicine. Everyone
Yeah,
wants to become cardiologist, everyone wants to become a
I
neurosurgeon. We're
agree with
getting
you.
saturated.
Yeah,
So at this point
yeah,
of time, this video is very important because I
yeah,
want some guys who are very passionate or more energetic to get into this kind of specialty. That is my actual
yeah.
intention.
Yeah. Actually, see, you rightly said, what is happening. See, I don't blame them, because, like their family, we should blame their family members, like, see, once you become a doctor, okay, once you are a doctor, people expect you to treat the patient. So, but I don't see nowadays. I used to see, or I think around 6 years or 7 years I practiced. I used to see patients and all, but now I don't feel like doing it, because I'm so busy. Like I'm busy with society activities, webinars. I'm busy with like writing books, writing articles, research work, and like again in the department also, I'll be busy with so many things, as a examiner, as a so many things are there. So I feel that okay, 8 hours working should be enough. And if I put extra hours, it should be for the society, it should be
Yeah.
for the general public, and it should be for improving the profession. And that is how, like I think it will become something else after achieving your basic needs. So when you are achieving your basic needs, you also need to concentrate on achieving it in a very unique direction. So I think that is what make me a better person today. If someone is trying to follow me, or someone is trying to appreciate me, or they think that I am a better person, it's only purely because I think differently and I work for it, and nothing comes easily. Okay, nothing comes easily. Nobody, like after becoming pharmacologist, if they think that okay, I will earn a crore by like joining a medical affairs department in a pharma company, that's not going to happen. Okay, so you need to work hard, you need to be concentrated. You should have, like, what generally, in industry or anywhere else, they will ask you, okay, what I am buying. Okay, you will also, like, when you are buying a pen, okay, whether it writes or not, you check, right now.
Yeah.
Hmm? Yeah, even if you are spending 5 rupees, you will ask, okay, whether this is a good pen, or like whether it lasts longer or something like that.
Now,
Similarly,
on a
people
small piece
also,
of paper, we write like this and then take.
yeah. Similarly, when a person is investing his time, money, and his future also, because generally how many molecules you can develop in a lifetime. Sometimes one company survives with only one molecule. Okay. So one blockbuster, it will your life is done. So like that. So when they are giving the lifetime, that's the achievements in concentrated in a position. Okay, yeah, because you will be the person who will take that molecule to the next level. Okay, so they will definitely think twice whether this person is the right person or wrong person. So that's why I suggest every youngster that work hard, gain knowledge, and be a professional, and at least have some courtesy to the people who are hiring you, and think twice before keep on changing. Because people are investing your time, you are investing your time there, and they are investing their time with you and money and the full assets on you, and there should be a very good win-win situation for you. So you can't just run behind money, or you can't run behind your own career, or you can't be so selfish. So you need to match yourself before taking a position to a particular company. And once you match, you stay longer, and with difficulty, without difficulty, whatever it is. So in that way, you will grow bigger. Okay, over a period of time. Because if you want to construct a hut, okay, it takes 24 hours. If you want to construct a palace, it may take lifetime also.
Yeah.
Many kings and queens, they died before entering doing gruha pravesha into their palace. Okay.
Got it, sir.
Yeah, so like that, like if you want a palace, so construct properly, put proper foundation, go slowly and ensure that proper planning is done. And then that is how you can build your career in a best possible way. Okay. So you have to be consistent in your efforts.
Got it, sir. So basically, but some work-life balance would be good in MD pharmacology because
Definitely.
night duties are
As I
not
told
there.
you, I think I stopped there itself. If you want to be a lazy person, you can only take two classes and then laze yourself.
Mm,
If you want to become little bit busy, you can start with the clinic. Okay,
mm,
class plus clinic. Or if you want to, become little bit more busy, then you can do pharmacovigilance jobs. Okay, there
mm,
are, you will be taken as the drug safety physician. From there, you will become senior drug safety physician. Then you will become director. You will be, associate director, director, and then vice president. Like that, there is a, career path left is there for a pharmacovigilance physician. If you want to become little bit more busy, or you like traveling, you can become medical advisor in a company, or a senior medical advisor, associate director, director. So like that, vice president, head of the department. So like that, you can grow your career as a medical affairs person. So if you are interested in writing, you can take the medical writing position, or you can enjoy as you if you are interested in teaching, you become a teacher.
oh,
Okay,
super.
so it's all you whatever you want to become. This is, I think, here only thing will not allow you to do surgeries. Okay, non-human. Okay, so that's the only thing you won't get with us. But you can do surgeries on animals. Okay, we have seen measurement of blood pressure in rat, measurement of blood pressure in cats, measurement of blood pressure in dogs. Okay, so that's you will surprise. We have seen our teachers, Dr. Venkatraman. He's no more today. He was the professor and head at St. John's Medical College. He showed us, blood pressure of rat, blood pressure recording of blood pressure, very thin, like any thread, like
Small.
blood vessels. Yeah, so he dissected them nicely, and he inserted the needle into it, and then he connected to the all the instruments, and then showed the blood pressure recording through the physiograph and all. And then he showed the blood pressure recording for the rabbits, and then dogs. Okay, so you can, like what I'm saying is, you want to become, you want to show your talent as a surgeon, you can very well do here by we have seen that like for CNS studies, they implant the electrodes on the rats, and then they do the EEG studies. So a lot of things, like, see, if you are really interested, if you are interested in cell biology, you can have incubators, you can have the trials run on cell lines, or if you are very much interested in softwares, you can do, support, with the help of softwares, you can develop some molecules and then patent it. So like this, like lot of things can be done. Only thing that, everyone cannot do everything. So one need
Mm.
to, even pharmacogenomics is the another important area, which is, which is there already with us. Only few people are, using that. So pharmacogenomics means, like, according to the genetic composition, you'll have to adjust the dosage of the drug.
Yeah.
Okay. Or you have to choose the drug also according to the metabolism, according to the enzyme category, or the genetic composition phenotypes. So you should be able to choose your, drugs accordingly. So that concept is coming in. So very less people have established their, research units related to this.
Yeah.
There is
Precision
opportunities.
medicine.
Yeah, precision medicine is another thing that is coming in.
Yeah.
So, like this, like as a pharmacologist, actually in some countries, they take the pharmacologists along with them for the rounds, actually, in the clinics. Okay, so that also is happening. And in companies like Apollo and like Fortis and all, they have MD pharmacologists as the, top heading the pharmacology department and clinical pharmacy. Okay, clinical pharmacy, clinical pharmacologist. So
Yes. Even
they
we have,
support,
sir.
yeah, drug interaction, like for
Yes.
to understand the drug interactions, avoiding
Correct.
the adverse drug reactions, reporting of adverse drug reactions, and medication error management. So, like, like this is one of the criteria in the NABH also. So NABH people also require, they have specified that, clinical pharmacology should be heading the clinical pharmacy and clinical pharmacology department in corporate hospitals, because many corporate hospitals are coming in. And like now all, I would say that, healthcare is getting transformed into next level. So at that time, like, I believe that, as a you are neurosurgeon,
I'm a neuroanesthesiologist.
you are neuro anesthesiologist. If I ask you, will you be able to remember all the drugs? I'm sure,
No.
it is difficult for you. Even,
Difficult.
I teach every day in day out. I'm not able to remember pharmacology, everything.
Mm.
Okay, so it is so vast. So we require, like, specialists to manage small things. Like if you divide, even actually some pharmacologists, they are also doing the, that is the pain clinic. No, they are also placed there. Actually,
Okay.
my batchmate, she is the second person who in the university. So she joined
Pain medicine.
pain medicine. So
Got it.
as a pharmacologist. So like this,
Got it.
you can make your footprint. Neuropharmacology. If you go to
Yeah.
Newman's, you have neuropharmacology departments are there. So their positions are available. So
Yeah.
most importantly, like if you go to, like, basically internationally, what happens? They don't recognize MD pharmacology. Okay,
Oh,
so that is the only one thing, which I feel that. So what you are supposed to do, you can do dual degree also. Some nowadays, that the dual degree concept is coming in. MD pharmacology plus PhD.
mm.
Okay, so after MD also you can register with any university, and then you can complete your PhD, and then you are free to go to any international universities as a, postdoc fellow or thing. I think, which I one more thing which I did not mention is that, like, there are a lot of positions in ICMR also.
Okay.
Okay. So in, like, as a scientist, they do take, as advisors, they take, like, DCGI also, Drug Controller General of India, or CDSUO. They also have some positions, but not many. But I believe that over a period of time, scenario will change because the complexities are increasing, and people would like to have MD pharmacologists as the, best advisor related to this. And anyway, like, for formulating the top documents top documents are the regulatory documents in India. Let it be any kind of policy, So generally, an MD pharmacologist will be there as a committee member. And if you go to DCGI, there are a lot of subject expert committee members are there. Okay, na? Subject matter experts. Okay, so like if you submit a neuro anesthesiology project for the any molecule for the purpose of neuro anesthesia, then there will be a neuro anesthesia committee will be there. In that, there will be one pharmacologist, okay, as
Got
an
it.
advisor to say that what is the pharmacological actions of it, what is the plausibility of approving, what is the like statistics or the what whether the data that is presented is in a good manner, bad manner, or any additional studies are required, is the safety is good or not. So like this kind of analysis, like this every like it can be diabetology or it can be any other like any nephrology. See every subject matter expert committee where they are reviewing the clinical trial or reviewing the new drug application. Okay, new drug application. So there you require a MD pharmacologist. Okay, so like this, there are a lot of opportunities are there. Only thing, everyone will not reach everywhere. That is something,
Got it.
so it's all based on their, like how they have built the relationship with the people. Like people communication is very important. It's not that like, see, you can read books, you can gain knowledge, but if you don't have the people communication, people, relationship, or if you don't have good skills to be push yourself into this, and
Okay.
generally people like to go there. Okay, in the
Okay.
private medical colleges, very few many seats are vacant. That's why our management are very little bit skeptical about like giving opportunity for us to host students. But
Yeah.
like if the people are interested and like most probably what they will do, maybe after ensuring that all the other clinical branches are established, pre and para established, maybe like they will start looking at us. Okay, like, we can also now we can plan for pharmacology, physiology, or anatomy, biochemistry.
Yes,
So
sir.
like this, they will also look into it. But like the more they delay, the more problems will be there. Because if you see,
Mm.
most of the like recent NMC survey, also I keep seeing some of the news is usually 2 to 3 like many medical colleges are running MD pharma, only two with 2 to 3 MD pharmacologists or 5 MD pharmacologists. Suppose if the requirement is 10, so only 50% of the staff are hired. But if we can have better, all these MD pharmacology positions are taken by the students, they can easily, one is they will get immediately government opportunities are also there. So many colleges have opened in North India and Maharashtra, or especially Rajasthan or Uttar Pradesh, Bihar. Many medical colleges have opened. Most of them are government medical colleges, and they don't have the professionals. I keep getting calls every day in day out about asking for MD
Mm.
pharmacologists, but we can't do anything. So sufficient MD pharmacologists are not available. So that's the one thing concern,
So, a lot of
scarcity.
vacancies, sir.
Vacancies
Scarcity
are
is there.
there. Yeah, vacancies are there. Only one more thing I would like to mention, that like especially medical colleges, they still
So actually, it's a mind-blowing video for me because I didn't know this much of subject about pharmacology, sir. After
yeah,
talking to you only, I came to know all these points. So I did some research, but I couldn't get these many points about pharmacology. And
yeah,
I'm requesting my subscribers.
yeah,
A lot of people would watch this video because the counseling will start, sir, now. The NEET
yeah,
PG exam is over a few days back,
yeah, yeah,
and now the results will come, I think, in a few weeks, and then the counseling season will start. So this video will go to multiple people,
yeah,
and I'm feeling rather than coming into the rat race and competition of all these, so-called, the super specialities,
yeah,
better to be in a less competitive area with more energy.
yeah, yeah.
As that is the way to actually grow faster, I feel. Correct, no, sir?
I think in Jaipur or some other place, one of MD pharmacologist, I think Agra, I believe. So he's the vice chancellor there. And so many of our friends, like even in MGMCRI, that's the Bharati Vidyapit, I would say Balaji Vidyapit in Pondicherry. So the vice chancellor is a pharmacologist, and a lot of pharmacologists are principals also. Many are principals and vice principals. So they can easily climb the ladder. Okay, because like, see, to become a principal or dean or a regulator or administrator in any medical college, what you require is the one MD degree with 5 years experience as the professor. Okay, that is the minimum requirement. And you don't need to be a neurosurgeon to become a principal or dean, or you don't need to. I'm just saying that you
Yeah.
don't need to. Everyone is having equal opportunities. But I would say that why we should waste the time of a neurosurgeon to become an administrator. He has
Hmm.
put in so many years, almost 15, 20 years to become a neurologist, neurosurgeon, and if he is put into this administrative job, so like it is a loss for the country, I would say,
Correct. Correct. I
right?
agree.
So because many patients should be getting treated by them, and they should be in the OT, and they should be. So when they will administer, if they become
Correct.
administrators. So I don't prevent them, but it's most importantly their need is there in treating the patients. So being an MD pharmacologist, I can run my department, I can run my college also easily. Okay, so not much of even I would say biochemist also can do, or a physiologist can do, or anatomist can do. So there is no much loss for the patients basically if we become. But if a clinician becomes, so much of useful, important, time will be wasted in managing the people and the facility. But their requirement is there in taking care of the patient. So like this, like if we can intelligently place the resources, most probably, like so majority of the pharmacologists and physiologists and anatomists, they can become more administrators,
Superb.
and other clinicians, they can head the clinical centers and treat the patients, and also support the administration. Basically, like they need to tell us what we are supposed to do, then we can help them getting the things what they want. Like that also, I'm just
Sup-
giving a kind of
Yeah, got it,
a
sir.
view. It may not be true because we have a surgeon who is our principal and dean. He is the wonderful person, like Dr. Ashok sir. I'm really thankful to sir because he gave us the position and all. But we have seen him such a great administrator. He still does the surgeries and he gives his time. So keeping all those, definitely like they can, because they know the inner side of surgery, clinical, everything, and they can definitely administer the clinicians better. But as a non-clinical department, we can also support the healthcare system through these methods also.
Superb, sir. Sir, to before we conclude, abroad opportunities, can you just comment, sir, if you feel it?
Yeah, I think I have already mentioned
Mention, yeah.
about
PhD,
the,
if you
yeah,
do, is what?
yeah. Basically, like if you are interested in teaching, if you are interested in teaching in international universities, generally they recognize PhDs. Okay, they don't
Okay.
recognize. So you may go, you can still go as a pharmacologist, but you will have to go with a PhD. Okay, so
Okay.
that will make you eligible to become a teacher in those countries. But with MD pharmacology, you can work in industries. Okay, so
Okay.
generally, what happens once you join in industry and MNC here, and they see the work and the kind of communication ability or production, they will see, and they will give the work visa. They will work out everything. They will make you comfortable in international places where they don't have access to MD pharmacologists in those countries. So they will take you there, and they will because MD pharmacologists can present the data better and convince the clinicians better, and they can basically, like, I believe that you as a MBBS and MD or MCH person, you will feel more comfortable to interact with an MD pharmacologist rather than a MR. a pharmacist, and you will like your level of discussion with an MD pharmacologist, and there is definitely a difference between a pharmacist and a pharmacologist, MD pharmacologist, and I think you will get more convinced when we tell you that what is the better way of understanding the data that is given, and in that way, we will be able to convince the clinicians better to use our drugs if I am representing a particular company. So in that way, we can build the customer relationship to the company better. So in that way, we can contribute better to that company. That's why they
Super.
prefer having MD pharmacologist.
Great, sir. I think we have covered significant part, almost like 1 hour, 10 minutes of content we generated.
Okay, so I could not recognize we exceeded the time. Yeah.
No, no, but it was very, very, very engaging and a lot of, your life actually is there in this video based on what I'm feeling. So your
Yeah, I
lifetime
think
experience, yeah.
yeah, basically, MD pharmacologists are they are versatile people, and they have most importantly, they should be ready to take that. Okay, they should think that first they should have the confidence inside that I am the best, I can do well. Okay, that should be there. If then you can the roads will automatically open where whichever the direction I gave you nearly for almost 10 directions, and you can choose which direction you would like to go. You can move forward, but it is not too difficult to change your path also. Okay, I started with clinical operations, moved to pharmacovigilance, then moved to operations, moved to like regulatory, then moved to, but it was not so, it's not a like transition was not so smooth. It was difficult only, but I have to the brainstorm myself with so much of new things, new information, continuous learning was required. At the end, again coming back to academics, was again it was difficult. It is not that easy because teaching is teaching pharmacology basics again. That was again like it was challenging, but if you have will, you can make a way.
Super. Ultimate, sir. So I think we got a complete overview of who should do MD pharmacology, how many job opportunities are there, different areas we can actually venture into after MD pharmacology, including medical colleges, the industry side, the research side, abroad. So complete overview you got. The competition level also is less that we understand. A lot of vacancies are there, scarcity is there. So awesome, actually, ultimate. I think a lot of people should consider getting into MD pharmacology in the top ranks. That is what I want because bright
We
guys should
have seen,
enter.
no, we have seen. It's not that we have seen second rank, third rank people taking MD pharmacology in AIMS, Maulana Azad, and now they are drawing crores of rupees as the
Salary.
salary. So it's not like what I'm saying is you can do, but most importantly you need to take yourself in the right direction. That is also required. What is your, whether you are behind money or you are behind you know um, happy life, so
Yeah,
you can do
both are possible.
whatever. Both are possible.
Correct, correct. Super. So then.